Question 1. A client with acute decompensated left-sided heart failure is admitted with severe dyspnea, pink frothy sputum, and oxygen saturation of 82% on room air. The nurse notes bilateral crackles and use of accessory muscles. Which intervention should the nurse implement first? Administer IV furosemide as prescribed. B. Apply high-flow oxygen via non-rebreather mask. C. Place the client in high Fowler's position with legs dependent. D. Initiate continuous cardiac monitoring. Answer. C. Place the client in high Fowler's position with legs dependent. Rationale. Positioning immediately reduces venous return, preload, decreases pulmonary congestion, and improves ventilation. This is the fastest independent action before oxygen and medications. Question 2. A client with chronic heart failure is receiving IV furosemide. Which assessment finding requires immediate nursing action? Urine output of 1200 milliliters in 4 hours. B. Serum potassium level of 2.9 MEQLL. C. Blood pressure of 1 or 2/64 millimeters mercury. D. Mild dizziness when standing. Answer B. Serum potassium level of 2.9 millicuries per liter. Rationale. Severe hypokalemia increases risk for life-threatening dysrhythmias, especially in heart failure patients, and must be corrected urgently. Question 3. A client with right-sided heart failure presents with worsening peripheral edema and hepatomegaly. Which intervention is the priority to reduce fluid overload? Restrict sodium intake. B. Administer prescribed loop diuretics. C. Elevate lower extremities. D. Monitor daily weights. Answer. B. Administer prescribed loop diuretics. Rationale. Loop diuretics rapidly remove excess fluid, directly addressing volume overload, the primary problem in right-sided heart failure. Question 4. A client with heart failure is receiving digoxin. The nurse notes a heart rate of 52 BPM and reports of nausea and visual disturbances. What is the nurse's priority action? A. Administer the scheduled dose of digoxin. B. Hold the medication and notify the provider. C. Check serum potassium level. D. Encourage oral fluid intake. Answer. B. Hold the medication and notify the provider. Rationale. Bradycardia and visual changes suggest digoxin toxicity. The medication must be withheld immediately to prevent worsening toxicity. Question 5. A client with acute heart failure is receiving IV nitroglycerin. Which assessment finding indicates the medication is effective? A. Increased urine output. B. Decreased pulmonary crackles. C. Elevated heart rate. D. Increased blood pressure. Answer. B. Decreased pulmonary crackles. Rationale. Nitroglycerin reduces preload, improving pulmonary congestion. Reduced crackles indicate improved fluid status in the lungs. Question 6. A client with heart failure develops sudden confusion, decreased urine output, and cool extremities. Which condition should the nurse suspect? A. Pulmonary embolism. B. Cardiogenic shock. C. Acute kidney injury. D. Hypervolemia. Answer. B. Cardiogenic shock. Rationale. Signs of poor perfusion, confusion, oliguria, cool skin indicate decreased cardiac output, leading to cardiogenic shock. Question 7. A nurse is caring for a client with heart failure who has gained 2.5 kilograms, 5.5 pounds, in 2 days. What is the priority nursing intervention? A. Document the weight gain. B. Encourage fluid intake. C. Notify the provider. D. Assess dietary sodium intake. Answer. C. Notify the provider. Rationale. Rapid weight gain indicates acute fluid retention, requiring prompt medical intervention to prevent decompensation. Question 8. A client with heart failure is prescribed an ACE inhibitor. Which finding requires immediate follow-up? A. Dry cough. B. Blood pressure of 90/58 millimeters of mercury. C. Serum potassium of 5.6 milliequivalents per liter. D. Mild dizziness. Answer. C. Serum potassium of 5.6 millik's per liter. Rationale. ACE inhibitors can cause hyperkalemia, which increases risk of dangerous cardiac dysrhythmias and requires urgent attention. Question 9. A client with heart failure is experiencing worsening dyspnea despite oxygen therapy. Which intervention should the nurse anticipate? B. Initiate non-invasive positive pressure ventilation, BiPAP. Administer beta blockers. D. Encourage ambulation. Answer B. Initiate non-invasive positive pressure ventilation, BPAP. Rationale. BiPAP improves oxygenation and reduces work of breathing in acute decompensated heart failure. Question 10. A client with chronic heart failure is being discharged. Which statement indicates a need for further teaching? A. I will weigh myself daily at the same time. B. I will call my provider if I gain 2 pounds in a day. C. I can stop my medications if I feel better. D. I will limit my salt intake. Answer. C. I can stop my medications if I feel better. Rationale. Heart failure requires lifelong management. Stopping medications can lead to rapid decompensation. Question 11. A client with acute decompensated heart failure is receiving IV furosemide. The nurse notes a blood pressure of 86/52 millimeters of mercury, urine output of 30 milliliters per hour, and increasing fatigue. Which action should the nurse take first? A. Continue the infusion as prescribed. B. Place the client in Trendelenburg position. C. Stop the diuretic infusion and notify the provider. D. Encourage oral fluid intake. Answer. C. Stop the diuretic infusion and notify the provider. Rationale. Hypotension and low urine output suggest reduced perfusion. Continuing diuretics can worsen volume depletion and precipitate shock. Question 12. A client with heart failure is prescribed spironolactone. Which laboratory value requires the most immediate intervention? A. Sodium 134 milliequivalents per liter. Potassium 5.9 MEq layer. C. Creatinine 1.3 milligrams per deciliter. D. BUN 22 milligrams per deciliter. Answer. B. Potassium 5.9 MEq liter. Rationale. Spironolactone is potassium sparing. Severe hyperkalemia increases risk of fatal dysrhythmias. Question 13. A client with worsening heart failure develops new-onset atrial fibrillation with rapid ventricular response. What is the nurse's priority intervention? A. Administer anticoagulants. B. Prepare for synchronized cardioversion. C. Administer rate-controlling medications. D. Monitor vital signs every 4 hours. Answer. C. Administer rate-controlling medications. Rationale. Controlling ventricular rate improves cardiac output and stability. Immediate cardioversion is reserved for unstable patients. Question 14. A client with left-sided heart failure suddenly develops severe respiratory distress and pink frothy sputum. Which medication should the nurse anticipate administering first? A. Morphine sulfate. B. Furosemide. C. Nitroglycerin. D. Dopamine. Answer: B. Furosemide. Rationale: the primary goal in acute pulmonary edema is to remove excess fluid from the lungs and reduce the heart's workload. Furosemide is the priority because it is a fast-acting loop diuretic. When given intravenously, it reduces preload through rapid venodilation and subsequent diuresis, effectively drying out the lungs. Morphine and nitroglycerin are adjunct treatments for vasodilation and anxiety, but do not address the fluid volume directly. Dopamine is used for low blood pressure, cardiogenic shock, not primary fluid overload. Question 15. A client with chronic heart failure reports increasing fatigue and dyspnea on exertion. Which finding indicates worsening cardiac output? A. Bounding peripheral pulses. B. Decreased capillary refill. C. Warm, flushed skin. D. Increased urine output. Answer: B. Decreased capillary refill. Rationale: poor perfusion, delayed capillary refill, reflects reduced cardiac output. Question 16. A client with heart failure is on fluid restriction. Which action by the nurse is most appropriate to manage thirst? A. Provide frequent ice chips. B. Encourage increased water intake. C. Offer salty snacks. D. Restrict oral hygiene. Answer: A. Provide frequent ice chips. Rationale: ice chips help relieve thirst without significantly increasing fluid intake. Question 17. A client with heart failure is receiving dobutamine infusion. Which assessment finding indicates the medication is effective? A. Decreased heart rate. B. Increased urine output. C. Elevated blood pressure. D. Increased edema. Answer: B. Increased urine output. Rationale: dobutamine improves cardiac output, leading to better renal perfusion and increased urine output. Question 18. A client with heart failure is noted to have jugular venous distension, JVD, and worsening edema. Which intervention should the nurse prioritize? A. Administer IV fluids. B. Restrict sodium intake. C. Administer diuretics. D. Encourage ambulation. Answer: C. Administer diuretics. Rationale: JVD and edema indicate fluid overload, requiring prompt diuresis. Question 19. A client with heart failure is prescribed a beta blocker. Which condition requires the nurse to hold the medication? A. Heart rate of 48 BPM. B. Blood pressure of 130/80 mmHg. C. Mild fatigue. D. Respiratory rate of 18 minutes. Answer: A. Heart rate of 48 BPM. Rationale: beta blockers reduce heart rate. Bradycardia increases risk of decreased cardiac output and must be addressed. Question 20. A client with heart failure suddenly becomes restless, anxious, and reports shortness of breath. Oxygen saturation drops to 88%. What is the nurse's priority action? A. Notify the provider. B. Increase oxygen delivery. C. Assess lung sounds. D. Document findings. Answer: B. Increase oxygen delivery. Rationale: hypoxia is life-threatening. Immediate oxygen support is the priority before further assessment or notification. Question 21. A client with acute decompensated heart failure is receiving high-dose IV diuretics. The nurse notes sudden onset muscle weakness, irregular pulse, and flattened T waves on ECG. Which action should the nurse take first? A. Administer potassium supplements as prescribed. B. Notify the provider immediately. C. Place the client on telemetry monitoring. D. Assess serum magnesium level. Answer. B. Notify the provider immediately. Rationale. The client is showing signs of severe hypokalemia with ECG changes, which can rapidly lead to fatal dysrhythmias. Immediate escalation is priority before interventions. Question 22. A client with heart failure is receiving IV nitroprusside. Which assessment finding requires the most immediate intervention? A. Blood pressure of 84/48 millimeters of mercury. B. Mild headache. C. Heart rate of 96 bpm. D. Flushing of the skin. Answer. A. Blood pressure of 84/48 millimeters Hg. Rationale. Nitroprusside can cause profound hypotension, which compromises organ perfusion and requires urgent intervention. Question 23. A client with chronic heart failure reports nocturnal dyspnea. Which intervention should the nurse recommend? Increase fluid intake before bedtime. B. Sleep flat without pillows. C. Use extra pillows or sleep in semi-Fowler's position. D. Avoid diuretics in the evening. Answer. C. Use extra pillows or sleep in semi-Fowler's position. Rationale. Elevating the upper body reduces venous return and pulmonary congestion, improving breathing at night. Question 24. A client with heart failure is prescribed sacubitril valsartan. Which assessment is priority before administering the medication? A. Heart rate. B. Blood pressure. C. Respiratory rate. D. Temperature. Answer. B. Blood pressure. Rationale. This medication can significantly lower blood pressure, so hypotension must be assessed prior to administration. Question 25. A client with heart failure is being treated for pulmonary edema. Which finding indicates improvement? A. Persistent crackles at lung bases. B. Oxygen saturation rising from 88% to 95%. C. Continued use of accessory muscles. D. Pink frothy sputum. Answer. B. Oxygen saturation rising from 88% to 95%. Rationale. Improved oxygenation reflects better gas exchange and reduced pulmonary congestion. Question 26. A client with heart failure is on a 2-gram sodium diet. Which food choice indicates understanding of dietary teaching? A. Canned soup. B. Processed deli meat. C. Fresh grilled chicken with herbs. D. Salted crackers. Answer. C. Fresh grilled chicken with herbs. Rationale. Fresh, unprocessed foods are low in sodium and appropriate for heart failure management. Question 27. A client with heart failure is experiencing decreased cardiac output. Which assessment finding supports this diagnosis? A. Warm extremities. B. Bounding pulses. C. Altered mental status. D. Increased urine output. Answer. C. Altered mental status. Rationale. Reduced cerebral perfusion leads to confusion, a key sign of decreased cardiac output. Question 28. A client with severe heart failure is receiving continuous oxygen therapy. Which intervention is most important to prevent complications? Limit oxygen to 2 liters per minute. B. Monitor skin integrity around the oxygen device. C. Remove oxygen every 2 hours. D. Encourage deep breathing exercises only. Rationale. Prolonged oxygen use can cause skin breakdown. Prevention is essential in ongoing therapy. Question 29. A client with heart failure is prescribed fluid restriction of 1.5 liters per day. Which action by the nurse is best to ensure adherence? A. Provide all fluids in the morning. B. Educate the client to track intake throughout the day. C. Restrict all fluids after 6 p.m. D. Allow unlimited intake if thirsty. Answer. B. Educate the client to track intake throughout the day. Rationale. Self-monitoring promotes adherence and prevents exceeding fluid limits. Question 30. A client with heart failure develops worsening crackles, weight gain, and dyspnea despite treatment. Which intervention should the nurse anticipate? A. Decrease diuretic dosage. B. Initiate fluid bolus. C. Increase diuretic therapy. D. Discontinue oxygen therapy. Answer. C. Increase diuretic therapy. Rationale. Persistent fluid overload requires more aggressive diuresis to relieve symptoms and prevent further decompensation. Question 31. A client with acute decompensated heart failure is on IV loop diuretics. The nurse notes a sudden drop in potassium from 4.2 MEq per liter to 3.0 MEq per liter within 12 hours with new ventricular ectopy on the monitor. What is the nurse's priority action? A. Continue diuretics and recheck labs in 6 hours. B. Administer prescribed potassium replacement. C. Notify the provider and prepare to administer antiarrhythmics. D. Decrease oxygen delivery. Answer. B. Administer prescribed potassium replacement. Rationale. Hypokalemia with dysrhythmias requires immediate correction to stabilize cardiac electrical activity. Question 32. A client with advanced heart failure is receiving IV dopamine at a moderate dose. Which finding indicates worsening condition requiring immediate intervention? A. Urine output increases to 50 milliliters per hour. B. Heart rate rises to 132 BPM. C. Blood pressure improves to 110/70 millimeters mercury. D. Client reports improved breathing. Answer. B. Heart rate rises to 132 BPM. Rationale. Tachycardia increases myocardial oxygen demand and can worsen cardiac function, indicating possible overstimulation from dopamine. Question 33. A client with chronic heart failure presents with increasing abdominal girth and ascites. Which intervention should the nurse prioritize? A. Encourage fluid intake. B. Administer prescribed diuretics. C. Measure abdominal circumference daily. D. Restrict protein intake. Answer. B. Administer prescribed diuretics. Rationale. Ascites reflects fluid overload. Diuretics directly reduce excess volume. Question 34. A client with heart failure is prescribed an ARB. Which laboratory value requires immediate follow-up? A. Potassium 5.7 millieq per liter. B. Sodium 136 millieq per liter. C. Hemoglobin 13 grams per dl. D. Platelets 220,000 millimeters squared. Answer. Potassium 5.7 meql liter. Rationale. ARBs can cause hyperkalemia, increasing the risk for dangerous cardiac dysrhythmias. Question 35. A client with heart failure develops acute pulmonary edema. Which intervention should the nurse implement first? A. Administer IV morphine. B. Place the client in high Fowler's position. C. Administer IV diuretics. D. Start IV fluids. Answer. B. Place the client in high Fowler's position. Rationale. Positioning rapidly decreases preload and improves lung expansion, making it the fastest immediate intervention. Question 36. A client with heart failure is receiving continuous IV heparin for atrial fibrillation. Which finding requires priority action? A. APTT of 90 seconds. B. Heart rate of 88 BPM. C. Blood pressure of 118/70 millimeters of mercury. D. Mild bruising at IV site. Answer. A. APTT of 90 seconds. Rationale. Excessively prolonged APTT indicates high bleeding risk, and requires immediate dose adjustment. Question 37. A client with heart failure has crackles halfway up the lung fields, oxygen saturation of 90%, and increasing anxiety. Which intervention is the priority? A. Administer prescribed anxiolytics. B. Increase oxygen delivery. C. Encourage rest. D. Monitor vital signs every hour. Answer B. Increase oxygen delivery. Rationale. Hypoxia is life-threatening. Improving oxygenation takes priority over all other actions. Question 38. A client with heart failure is on digoxin therapy. Which electrolyte imbalance increases the risk of toxicity? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer B. Hypokalemia. Rationale. Low potassium enhances digoxin binding, increasing risk of toxicity. Question 39. A client with heart failure is prescribed daily weights. Which finding requires immediate reporting? A. Gain of 1 pound in 24 hours. B. Gain of 3 pounds in 2 days. C. Loss of 1 pound in 24 hours. D. Stable weight for 3 days. Answer B. Gain of 3 pounds in 2 days. Rationale. Rapid weight gain signals fluid retention and worsening heart failure. Question 40. A client with severe heart failure is being evaluated for decreased perfusion. Which assessment finding indicates most critical deterioration? A. Mild peripheral edema. B. Urine output of 20 milliliters per hour. C. Blood pressure of 118/76 millimeters per H. D. Heart rate of 92 BPM. Answer B. Urine output of 20 milliliters per hour. Rationale. Oliguria indicates poor renal perfusion and severe decrease in cardiac output, signaling critical deterioration. Question 41. A client with acute decompensated heart failure is receiving IV nitroglycerin. The nurse notes a sudden drop in blood pressure to 78/46 millimeters of mercury, and the client reports dizziness. What is the nurse's priority action? A. Increase the infusion rate. B. Stop or reduce the infusion and notify the provider. C. Place the client flat in supine position. D. Administer IV fluids rapidly. Answer B. Stop or reduce the infusion and notify the provider. Rationale. Severe hypotension from vasodilation compromises perfusion. The medication must be reduced or stopped immediately. Question 42. A client with chronic heart failure reports worsening fatigue and decreased activity tolerance. Which intervention is most appropriate to improve energy conservation? A. Encourage continuous activity. B. Schedule activities with frequent rest periods. C. Limit all physical movement. D. Increase fluid intake before activity. Answer B. Schedule activities with frequent rest periods. Rationale. Energy conservation reduces cardiac workload while maintaining functional capacity. Question 43. A client with heart failure is receiving IV furosemide. Which finding indicates a potential complication of therapy? A. Increased urine output. B. Weight loss of 1 kilogram. C. Tinnitus and hearing changes. D. Decreased edema. Answer C. Tinnitus and hearing changes. Rationale. Ototoxicity is a known complication of high-dose or rapid IV loop diuretic administration. Question 44. A client with heart failure has a BNP level significantly elevated. What does this indicate? A. Improved cardiac function. B. Decreased fluid volume. C. Ventricular stretch and fluid overload. D. Normal cardiac status. Answer C. Ventricular stretch and fluid overload. Rationale. Elevated BNP reflects increased ventricular pressure and volume overload. Question 45. A client with heart failure develops a new cough and crackles after receiving IV fluids. What is the nurse's priority action? A. Continue IV fluids. B. Stop the IV fluids and notify the provider. C. Encourage deep breathing. D. Place the client in supine position. Answer. B. Stop the IV fluids and notify the provider. Rationale. IV fluids can worsen pulmonary congestion in heart failure and must be stopped immediately. Question 46. A client with heart failure is prescribed metoprolol. Which assessment finding requires the nurse to hold the medication? A. Heart rate of 54 BPM. B. Blood pressure of 128/78 mmHg. C. Respiratory rate of 20 minutes. D. Mild fatigue. Answer. A. Heart rate of 54 BPM. Rationale. Beta blockers can cause bradycardia. A low heart rate increases risk of decreased cardiac output. Question 47. A client with heart failure is on a fluid restriction. Which statement indicates a need for further teaching? A. Will measure all fluids I drink. B. I will eat foods with high water content freely. C. I will space fluids throughout the day. D. I will track my daily intake. Answer. B. I will eat foods with high water content freely. Rationale. Foods like soups, fruits, and gelatin count toward fluid intake and must be restricted. Question 48. A client with severe heart failure becomes increasingly confused and restless. Vital signs show BP 88 to 54 millimeters of mercury, HR 118 ppm, and SpO2 89%. What is the nurse's priority action? A. Administer oxygen. B. Notify the provider. C. Assess urine output. D. Reposition the client. Rationale. Hypoxia is immediately life-threatening and must be corrected first to improve tissue perfusion. Question 49. A client with heart failure is prescribed IV morphine for pulmonary edema. What is the primary purpose of this medication? A. Increase heart rate. B. Reduce anxiety and preload. C. Improve renal perfusion. D. Increase blood pressure. Answer. B. Reduce anxiety and preload. Rationale. Morphine decreases venous return and anxiety, improving breathing and reducing cardiac workload. Question 50. A client with chronic heart failure asks why daily weight monitoring is important. What is the nurse's best response? A. It helps assess your nutritional status. B. It detects fluid retention early. C. It measures muscle mass changes. D. It determines medication dosage. Answer. B. It detects fluid retention early. Rationale. Rapid weight gain is a sensitive indicator of fluid accumulation and worsening heart failure.
You just worked through some of the most dangerous heart failure priority traps you'll ever see on the Nclex. If you noticed anything, it's this. Nclex is not about memorizing. It's about who you save first, what you fix first, and what will kill your patient first. Heart failure questions are designed to trick you with good options, but only one action protects airway, breathing, or perfusion immediately. If you can think in priorities like this, you're not just preparing for an exam. You're thinking like a real nurse under pressure. Don't stop here. Go back, review the ones you missed, and ask yourself, why was my answer wrong? What did I overlook? That's how you level up. More high-level Nclex drills are coming. Harder, sharper, and exactly what you need to pass. Stay focused, stay dangerous. Your license is closer than you think.